With me now is Professor Margaret Johnson, who is Academic Vice President at the Royal College of Physicians. Hello to you.
Hello.
So tell me, what role does the Royal College of Physicians play in supporting academic activity?
So I think huge. We're here today in Manchester, and this is very much about keeping doctors up to date from both a clinical point of view, but also what's going on in terms of education, how to get involved in research, what the Royal College of Physicians is doing around research, and really highlighting the major issues facing physicians today in their daily work.
Now, why is it important for physicians to get involved in research? Does it help them in their daily work?
So I think absolutely crucial for doctors to be involved in research. There was a really very important paper published at the end of last year that looked at the colorectal cancer outcomes in the UK. Now, they are very sorted out in terms of having a fantastic registry of all the patients diagnosed with colorectal cancer over many years. And what they showed were that the patients who were looked after in research active units had better outcomes, and the outcomes were better the longer that those patients' units had been involved in research.
Now, what tools and resources do you sort of practically give to members in their research?
The key things that we are doing for our clinicians is, first of all, we've done a big survey of about 2,000 clinicians looking at what are the barriers to them participating in research. So first and foremost is time. Given the pressures in the NHS, what we call supporting professional activities have been under huge pressure. So historically, our job plans were that probably 25% of our time was for CPD, research, management, teaching. That's been squeezed by, what the pressures at the front door. We've also looked at, are people actually, do they want to get involved in research? And the answer is absolutely, and they want to get engaged more. I think that the other issues are research and development departments are seen to be opaque, not easy to deal with. So we're very much looking at that. We are working with R&D departments to come up with a good practice guide to how R&D departments can support our clinicians getting involved in research.
If we look going forward into the future, how do you think that role of the Royal College of Physicians is going to maybe change in supporting innovation and research?
I think it's going to become ever more important. Being able to appraise new data is going to be absolutely crucial for every clinician, and it's going to be very much part of curricula in terms of trainees, but actually we're sort of all trainees really. We should be training all our lives. So I think that putting together training courses around how to get involved or re-involved in research is really important.
So thinking about the conference, what would you like delegates to take away this year?
So what I'd like delegates to take away is that we've met their needs, that they've got their clinical updates, but also their other interests have been covered. So there are education sessions, there are sessions about what the college is doing for them. I think though, in terms of what are the highlights in terms of the speakers, I'm really looking forward to hearing Professor Jane Dacre, our president, telling us where she sees healthcare going. We've got Philip Dunn, who is from the Department of Health, who will be talking to us from a government point of view. We've got Dr. Adrian Wolfson, who is the global oncology lead from Pfizer, who's going to talk to us about how the NHS might be able to afford the new cancer drugs. And I'm looking forward to hearing what our patients say. So we've got a patient who's going to talk to us about how it is to be a patient in the NHS. That will be a great session as well.
Fantastic. Well, Professor Margaret Johnson, thank you very much.
And thank you.